Hello and welcome to this video covering ergonomic nursing issues. Our group consists of Caitlin Couser, Reed Rogers, Calvin Godwin, and Hannah Porter. The main issue that nurses face involves injuries that occur while lifting patients. Throughout a workday, a nurse may be required to make multiple heavy lifts by themselves at awkward angles. This combination is a common recipe for musculoskeletal disorders and lower back injuries. To back this up, we have a figure that shows the occupations with the most injuries that result in lost workdays. Noted in dark green are nursing positions. As you can see, of these 8 positions, 4 of them are nursing-related occupations. They are orderlies, nursing assistants, personal care aides, and registered nurses.
Next, we have a couple different nursing statistics. One being that in all of the nursing injuries, 89% of them occur from patient handling. This could consist of moving a patient from a wheelchair to a bed or helping a patient go to the bathroom. Also, musculoskeletal disorders are injuries and disorders that affect the human body's movement or musculoskeletal system, which consist of the muscles, tendons, ligaments, nerves, etc. Low back pain is one of the most prevalent work-related musculoskeletal disorders in the industry. That being said, the lower back is the most vulnerable link in the musculoskeletal system.
The spine is composed of vertebrae, nerves, and the spinal cord. Musculoskeletal disorders can occur when the nerves get pinched or damaged. In the lower back, the weak spot is between the L5 and S1 disc. This is due to the amount of weight that the segments bear, and this is where most back injuries occur. OSHA has many regulations, but one of the ones that is most frequently broken is to not lift loads greater than 50 pounds. Lifting loads greater than about 50 pounds will increase the risk of injury. In most industries, even in the automotive, workers were not allowed to lift anything heavier than 35 pounds. So, in an industry notorious for injuries, how do we fix this? We can help nurses by training them better, installing ceiling-mounted patient lifting devices, or purchasing portable patient lifting devices.
The first method of improvement is training. This is a very broad idea. The first portion of training involves proper lifting technique. Nurses must maintain a straight back, lift from the legs, and keep the load close to the body. This will allow them to avoid many of the musculoskeletal disorders that we mentioned earlier. The lifting motion that nurses must employ will use a smooth ballistic path that aligns with the natural movement of the body. The most important and helpful lifting technique that nurses can employ, however, is the buddy system. The buddy system is using 2 or more nurses to lighten the overall load for each nurse. Despite all of these training and regulations, nurses are still getting injured in hospitals. This is because the weight of patients is too much for the nurses to lift. Therefore, something else must be done to improve this. The first of these new options is a ceiling-mounted patient lifting device. The figure shown is a common example of one of these. These devices can lift a patient up to 700 pounds, but they do cost around $7,000 just to purchase. This is not considering installation costs. These are relatively cheap to install in a new hospital, but retroactive installation can be very expensive. This leaves portable patient moving devices. These are much more feasible for hospitals to purchase. They only cost around $1,000 and there is no installation. The only drawback to these is they can only lift 400 pounds. Whatever option hospitals choose, they must do something to get nurses out of harm's way. If you are interested in researching this topic further, here's a look at our references. Thank you.